While the COVID-19 restrictions are being lifted around the world, the Chinese Communist Party continues to enforce its draconian zero-COVID prevention policy, forcing large numbers of people to be confined to their homes or transported elsewhere for quarantine, resulting in a constant stream of people suffering from hunger, bankruptcy, and even suicide. A major car accident on September 18th, which killed 27 people, was a disaster caused by this policy. On September 18th at around 2:40 a.m., a bus carrying 47 people overturned and fell into a deep ditch by the roadside on the Shui-zu County section of the San Li Expressway between Guiyang and Libo. The accident resulted in a total of 27 dead and 20 injured. Local informants revealed that the bus was pulling Guiyang citizens to a different place for isolation. The picture uploaded by netizens also shows that the driver of the vehicle was wearing a full set of protective clothing, and the passengers on board were also wearing protective clothing, so it's obvious that this is not a normal passenger bus. Some commentators believe that the driver's clothing caused his concentration and vision to be affected. That, combined with the early morning hours and possible fatigue, may have been the cause of this major accident. After the accident, public security officials of San Li County, Guizhou province, only briefly reported on the matter, saying a bus overturned and the number of casualties involved. They did not release the list of passengers, nor did they mention why vehicles from infected areas were allowed to travel on the highway or even during the time of closure, nor did they say whether it was related to epidemic prevention. However, this accident immediately sparked public opinion against the mandatory isolation and closure of the city, which continues to be discussed on social media platforms across China. The topic, Guizhou high-speed accident vehicle was an isolation transfer vehicle, was once the #1 trending topic on Weibo, with over 100 million clicks at one point. Chinese netizens criticized the CCP's zeroing policy, saying that zeroing wins out over human life. One netizen said the number of people killed in the bus was 27. Even if the entire population of Guiyang turned positive, there wouldn't have been this many deaths. This prevention policy is going to kill so many people. After the public outcry, the CCP authorities quickly deleted the post and blocked the comments. On Chinese social media, several articles denouncing the authorities' forced quarantine and city closure appeared briefly and were immediately deleted. Sources say that the authorities requested the incident to be uniformly referred to as a traffic accident. In order to avoid censorship, some netizens did not mention Guizhou, high-speed accident, or isolated transfer in their posts, but instead used metaphors like, "We were all on the bus, just that it hasn't flipped over." It was not until the afternoon of September 18th that Guizhou officials admitted that the bus was indeed an isolation transfer vehicle. The press office of the Guiyang municipal government held a press conference in the evening of that day, saying that the vehicle was an anti-epidemic transfer requisition vehicle. The bus picked up people from Yunnan District, driving to the quarantine hotel in Libo County, departing from Daying Road at 10 past midnight on September 18th. The bus was carrying 47 people, including one driver and one staff member, and the other 45 were all residents of Yunnan District. According to Caixin.com, most of the people in the accident vehicle came from Xiangyang Compound in Yunnan District. According to the residents there, several buses stopped at the entrance of Xiangyang Compound at around 8 p.m. on September 17th, and a large number of residents gathered downstairs with their luggage and then boarded the bus. This video shows the last time the bus and the 47 residents were seen. Who would have thought at the time that this would be a one-way trip? According to information released earlier, another resident that was being transferred said when the accident occurred, her bus was right behind them, and she saw the entire process. She said in a group chat that there were a total of 6 vehicles from Yunnan District to Libo County. After the bus rolled down the slope, they were all stunned and waited several hours until rescue workers arrived. She also said that details of the situation may not even be allowed to be posted. One person who claimed to be a family member of a victim posted on Weibo revealing that everyone involved in the accident had already spent half a month at home in isolation. All of them had green health codes. They were transferred only because they were close contacts. A citizen who claimed to be from the Xiangyang compound revealed in his circle of friends that his mother was confirmed dead in the accident. He said that his parents never goes out except for nucleic acid tests, and their health codes have been green. Yet, in the evening of September 17th, they suddenly received a notice from the government to prepare to take the bus to Libo County for isolation. He stressed that everyone on the bus who were forcibly transferred were all green-coded, which was unacceptable to him. So why were they being transported in the middle of the night? Who will be held responsible for this major accident? According to Radio Free Asia, several urban areas have been under so-called silent management since the first case of the current round of infections was reported in Guiyang on August 31st. The noticed implementation plan for the 10 specialized actions for epidemic prevention and control in Guiyang City was released by the authorities and states that it is necessary to ensure the city will be zeroed by September 19, 2022. Current affairs commentator Li Hengqing also believes that the cause of the accident is related to the request of Guizhou province and Guiyang municipal government to achieve social zero as soon as possible in order to not affect their careers. And the authorities require all confirmed cases and close contacts to be quickly transferred within 2 hours. Some netizens also posted that because of the prevention and control in Guiyang to achieve social zero on September 19th, even with one positive case in a building, everyone else will be pulled to surrounding counties for isolation. In 2 days, dozens of buses were seen transporting residents from infected areas such as Huaguoyuan to various counties in the province. A video posted by a netizen shows that, also on the night of September 17th, a large number of people in blue protective clothing in the Huaguoyuan neighborhood of Guiyang lined up to get on the bus and were pulled to some place for isolation. One person said he was dragged to a mental hospital for isolation. According to the transfer plan previously announced by Guiyang municipal government, up to the time of the incident, Guiyang has transferred 7,396 confirmed cases and close contacts out of the city, and is currently transferring 2,900 people. Commentator Li Hengqing said, "This incident was caused by the management system and this zeroing policy, which eventually led to consequences. The dynamic zeroing and silent management are not really aimed at solving China's epidemic problem, which is not a medical problem but a political one, to create the so-called atmosphere for the 20th National Congress." In addition, Guiyang City has been closed since September 5th due to the epidemic, and currently more than 100 highway intersections and several service areas in Guizhou are under control, including where the accident occurred. Moreover, according to Chinese law, buses are prohibited from entering highways and driving on highways from 2 a.m. to 5 a.m. And Guizhou has strictly enforced this law because of the mountainous roads and complicated road conditions. Therefore, some Chinese netizens pointed out that the bus was able to travel on the highway late at night without any obstruction because of the support of the local government. So it was pointed out that the people in charge of the various segments involved in the transfer clearly violated the current traffic safety regulations. At present, 3 cadres of Guiyang City have been dealt with for this major traffic accident. A netizen who claimed to be from the local transportation system revealed that the incident has now entered the claims process, but they are not sure if there is an official compensation in addition to the insurance claims of the bus. However, a Guiyang resident told Radio Free Asia that although the accident has led to a lack of trust in official transfer measures, the transfers have not stopped. This citizen believes that the so-called isolation has no meaning other than to increase cost and even greater danger. Not only that, but a Sichuan netizen posted that local officials, after the accident, asked all those who were forcibly isolated to sign a waiver saying that they would not be responsible if an accident occurred during the transfer, leaving people speechless. In fact, in order to achieve the so-called social zero as soon as possible, many places in China are practicing this kind of off-site isolation, On September 18th, a video showed a whole busload of people in protective clothing trapped in an isolated transfer vehicle in Dazhou, Sichuan province, including children and the elderly. The person who recorded the video said, "We are working with the government today to prevent the epidemic. Now we're trapped in a car. It's been 7 hours and everyone needs to go to the washroom. They parked here for 1 to 2 hours and abandoned us." Over the past few days, many Chinese netizens have criticized the government's zero policy. They have questioned why the authorities continue the unscientific closure policies when foreign countries have already relaxed their epidemic control and even lifted restrictions on entry and exit. The people of Chengdu have broken through their isolation gate. How long before the Chinese people break out of the CCP's cage? A baby born just 2 months ago was sent to mandatory isolation at a hospital in Qingdao, Shandong province. Pictures on Weibo show a baby lying in the hospital bed while medical staff dresses him in an isolation suit. In the Tibetan capital of Lhasa, residents who have been under home confinement for more than a month have recently complained to the outside world via microblogs about the lack of medical care and medicine. The netizens revealed that dozens of buses secretly pull people into isolation in the middle of the night. The so-called Fangzhan Hospital is rough, where life is extremely inconvenient and people are unable to take a shower, but are beaten up when they ask for supplies. In the 4,800-meter high mountains of Shigatse, Tibet, the authorities have set up tents in the snow as isolation points. Makes you wonder whether they considered the issue of food. On September 15th, a video was circulated on the internet showing epidemic prevention officers destroying items purchased online by residents of a closed area. In the video, an officer in protective clothing is seen throwing materials gathered in one place into a garbage truck. The bags and boxes are full of vegetables, fruits, and other household items purchased online by the residents of the area. According to The Voice of America, there was a case in Xinjiang where a Kazakh sheep herder was forcibly isolated because he was just herding sheep and had no contact with anyone. After being isolated in the city, his 350 sheep in the grassland were left unattended and either starved to death, eaten by wolves, or chased by wild dogs off a cliff. In the end, only 33 of the 350 sheep were left, resulting in losses of more than 300,000 yuan. What's even more disheartening is that this cruel policy shows no sign of ending. China's National Health Commission has announced that regular nucleic acid testing will resume by October 31st, even in areas where there is no outbreak. Why before October 31st? Because the CCP held the 7th plenary session of the 19th Central Committee on October 9th and the 20th National Congress on October 16th. So the notice from the Health and Welfare Commission is entirely under the pretext of epidemic prevention to achieve control of the community.